If you're over 60 and you've noticed reduced energy, colder hands and feet, slower recovery, or weaker erections than you used to have, there's something important you need to understand. In many cases, the issue isn't just aging, it's blood flow, and more specifically, declining vascular efficiency. As a urologist working primarily with men over 60, I see this pattern constantly. Patients assume it's just testosterone, or, I guess this is what happens at my age. But in reality, one of the most overlooked drivers of performance decline after 60 is impaired circulation. And here's the encouraging part. Blood flow is dynamic, which means it can improve, but only if you address the mechanisms behind it. In this video, I'm going to explain 4 specific foods that have measurable effects on vascular function, particularly after 60, not exotic superfoods, not expensive supplements. Just foods that influence nitric oxide production, arterial flexibility, and endothelial health. Before we go further, let's clarify what changes after 60. Arteries naturally become stiffer. The inner lining of blood vessels, called the endothelium, produces less nitric oxide. Nitric oxide is the molecule responsible for relaxing blood vessels. When nitric oxide levels decline, arteries don't expand as easily. Circulation becomes less responsive. Blood flow under stress becomes weaker. Now here's something most people don't realize. The arteries supplying the penis are smaller than coronary arteries. That means vascular decline often shows up there first. Reduced erection quality can be an early sign of endothelial dysfunction, but it's not just about intimacy. Poor circulation also affects cognitive clarity, physical endurance, muscle recovery, even kidney function. Blood flow is foundational. Now, medication can temporarily enhance nitric oxide signaling, but medications don't rebuild endothelial health. They amplify what's left. If baseline vascular function continues declining, responsiveness becomes less consistent. That's why lifestyle and dietary inputs matter. Let me explain the mechanism briefly. Healthy blood flow depends on 3 main factors: nitric oxide production, arterial flexibility, low inflammatory load. After 60, all 3 tend to decline unless actively supported. The good news? Certain foods directly influence these pathways. They increase nitric oxide availability, they reduce oxidative stress, they improve endothelial signaling. But here's where many people make a mistake. They focus on random, heart-healthy foods without understanding mechanism. Or they assume any fruit or vegetable automatically improves circulation. That's not accurate. Some foods are neutral, some are beneficial, and some specifically target nitric oxide pathways. In this video, I'll walk you through 4 that consistently show measurable vascular benefits, especially in older adults. The first one works by increasing nitric oxide precursors. The second improves endothelial signaling. The third reduces arterial stiffness. And the fourth supports hormonal balance alongside circulation. Before I reveal them, let me make one thing clear. No food works in isolation. This is not about eating one item once and expecting dramatic change. This is about consistent intake that gradually improves vascular responsiveness. When vascular responsiveness improves, many men over 60 notice stronger morning erections, better physical stamina, warmer extremities, more consistent performance. Not because they boosted testosterone, but because they improved blood delivery. In the next section, I'll begin with food number 1 and explain exactly how it affects nitric oxide production at a molecular level. Once you understand the pathway, the logic becomes clear. Let's begin with food number 1, and this one has some of the strongest vascular data behind it. Food number 1, beets and beetroot. Beets are rich in naturally occurring nitrates. Now, when most people hear nitrates, they think of processed meats, but plant-based nitrates behave very differently in the body. Here's what happens physiologically. When you consume natural nitrates from beets, they are converted by oral bacteria into nitrites. Those nitrites are then converted into nitric oxide in the bloodstream. Nitric oxide is the molecule responsible for telling blood vessels to relax. When blood vessels relax, arterial diameter increases, blood flow improves, oxygen delivery rises. After 60, nitric oxide production declines significantly. That's one reason vascular responsiveness weakens with age. By increasing dietary nitrates, you provide raw material for nitric oxide synthesis. Clinical studies show that beetroot consumption can improve endothelial function, lower systolic blood pressure, enhance exercise tolerance, increase peripheral circulation. Now here's what's particularly interesting for men over 60. Nitric oxide is the primary chemical signal involved in erection mechanics. Without sufficient nitric oxide, arterial dilation in the penile tissue is incomplete. That leads to weaker rigidity. Beets don't act like medication. They don't force dilation. They improve the body's ability to generate the signal naturally. I had a 68-year-old patient who incorporated beet juice into his routine 3 to 4 times per week. Within 6 weeks, he reported stronger morning erections, better endurance during walks, warmer hands and feet. Now, is beetroot a cure-all? No. But it is one of the most direct dietary ways to influence nitric oxide availability. How to use it practically. Fresh roasted beets. Beet juice, unsweetened. Beet powder added to smoothies. Consistency matters more than dose. Now let's move to food number 2. This one works differently. Instead of supplying nitric oxide precursors, it protects the endothelium. Food number 2. Pomegranate is rich in powerful antioxidants called polyphenols, particularly punicolagens. Oxidative stress is one of the biggest enemies of vascular health after 60. Here's what oxidative stress does. Damages the endothelial lining, reduces nitric oxide availability, promotes arterial stiffness. When the endothelium becomes inflamed or damaged, it cannot release nitric oxide effectively. Even if your body produces it, oxidative stress can neutralize it. Pomegranate helps reduce that oxidative burden. Multiple studies show that pomegranate juice can improve endothelial function, reduce arterial plaque progression, increase nitric oxide bioavailability, lower blood pressure modestly. What's important here is bioavailability. Nitric oxide is fragile. Oxidative stress destroys it quickly. Pomegranate helps preserve it. I often describe it to patients this way. Beets help you produce nitric oxide. Pomegranate helps you protect it. I had a 72-year-old patient with mild hypertension and declining erection consistency. He added 4 to 6 ounces of pure pomegranate juice daily. After 2 months, we observed improved blood pressure readings, more consistent rigidity, better overall vascular markers. Again, not dramatic overnight change, but steady improvement. Now notice something. Food number 1 increases nitric oxide production. Food number 2 protects nitric oxide from degradation. Different mechanisms, same pathway. And this layering is important, because after 60, vascular decline is rarely due to one factor alone. It's cumulative. In the next section, we'll move into food number 3, which specifically targets arterial flexibility, and food number 4, which supports both circulation and hormonal balance. Now let's move to food number 3. This one targets something that becomes increasingly important after 60. Arterial stiffness. Food number 3. Extra virgin olive oil. As we age, arteries don't just narrow, they become less elastic. Healthy arteries are flexible, they expand and recoil with each heartbeat, but over time, due to chronic low-grade inflammation, oxidative stress, insulin resistance, sedentary behavior, arteries stiffen. Stiffer arteries mean higher blood pressure, reduced perfusion to small vessels, slower blood delivery during demand. And remember, the arteries supplying erectile tissue are very small. Even slight stiffness significantly affects responsiveness. Extra virgin olive oil, particularly high polyphenol varieties, has been shown to improve endothelial function and reduce arterial stiffness. The mechanism is multi-layered. Polyphenols reduce oxidative stress. Anti-inflammatory compounds protect the endothelium. Monounsaturated fats improve lipid profiles. It enhances nitric oxide signaling efficiency. In Mediterranean populations, where olive oil consumption is high, vascular aging tends to progress more slowly. Now, olive oil is not a quick-acting intervention like nitrates. It works gradually by improving the vascular environment. I had a 70-year-old patient who transitioned from processed vegetable oils to high-quality extra virgin olive oil as his primary fat source. Over 4 to 6 months, his inflammatory markers improved modestly. More importantly, he reported more consistent erections, improved stamina during activity, better recovery after exercise. Olive oil supports structural vascular health. It improves the plumbing, so to speak. Now, let's move to food number 4. This one works differently. It supports both circulation and hormonal balance. Food number 4. Dark leafy greens, especially spinach and arugula. Leafy greens are rich in natural nitrates, magnesium, folate, vitamin K. Magnesium plays an underrated role in vascular health. It helps regulate smooth muscle relaxation, blood pressure, endothelial tone. Low magnesium levels are associated with increased arterial stiffness and reduced nitric oxide availability. After 60, dietary magnesium intake is often inadequate. Leafy greens also contribute plant-based nitrates, similar to beets, but in smaller, steady amounts. And here's something particularly relevant for men over 60. Magnesium supports testosterone bioavailability. It does not dramatically increase total testosterone, but it may improve the ratio of free to bound testosterone. That matters, because free testosterone is biologically active, so leafy greens contribute in 2 ways: vascular support, hormonal modulation. I've seen men who significantly increase their intake of dark leafy greens, especially in combination with the other foods we've discussed, report gradual improvement in morning erections, energy levels, blood pressure readings. Now let's step back and look at the synergy. Beets increase nitric oxide production, pomegranate, protect nitric oxide, olive oil, improve arterial flexibility, leafy greens, support vascular tone and hormonal balance. Different mechanisms. Same goal, improved blood delivery. After 60, circulation declines not because of one single defect. It declines because of accumulated inefficiencies. When you stack supportive foods strategically, you reduce those inefficiencies. Now, I want to set expectations properly. This is not an overnight transformation. You may not notice dramatic changes in 1 week. But here's the typical pattern I observe clinically. Weeks 2 to 4. Slight improvement in energy. Warmer extremities. Better exercise tolerance. Weeks 4 to 8. Increased frequency of morning erections. Improved consistency. Weeks 8 to 12. Stronger responsiveness under stimulation. Better stamina, because endothelial repair and vascular remodeling take time. In the final section, I'll give you a simple weekly structure to incorporate these foods practically without making your diet complicated. Because sustainability is what determines outcome. Let's make this simple and practical. If you are over 60 and want to improve blood flow naturally, this is not about dramatically changing your life overnight. It's about strategic consistency. Here's how to integrate the 4 foods without overcomplicating your routine. A simple weekly circulation framework. Daily foundation. 1. Extra virgin olive oil. Use it as your primary fat source. Drizzle over vegetables. Use in salads. Replace processed seed oils. Target 1 to 2 tablespoons daily. This supports long-term endothelial flexibility. 2. Dark leafy greens. Include at least 1 serving per day. Spinach in omelets, arugula in salads, sautéed greens with dinner. Blended into smoothies. Consistency matters more than quantity. 3-4 times per week. Beets. Roasted beets with meals. 4 to 8 ounces of unsweetened beet juice. Beet powder added to water or smoothies. This supports nitric oxide production. If you notice slightly pink urine, that's normal with beet consumption. 3-5 times per week. Pomegranate. 4-6 ounces pure pomegranate juice. Fresh seeds added to salads or yogurt. Avoid added sugar products. This protects nitric oxide and reduces oxidative stress. Now here's something important. These foods work best when you simultaneously reduce vascular stressors, smoking, sedentary living, excessive alcohol, highly processed food. Because you cannot out-eat chronic inflammation. Nutrition supports the system, but it does not override damaging inputs. What improvements typically look like? I want to give you realistic expectations. After 60, vascular change is gradual. But here's what I commonly see when men implement this consistently. Weeks 2 to 4. Slight improvement in stamina. Better recovery from walks or exercise. Warmer hands and feet. Weeks 4-8. More frequent morning erections. Slightly improved rigidity. More consistent responsiveness. Weeks 8 to 12. Noticeably stronger blood flow. Increased confidence. Improved endurance. Morning erections are often the first vascular signal to return. That's because they're largely reflex-driven and dependent on healthy endothelial function. Now let me say something important. If you experience sudden erectile dysfunction, chest discomfort, shortness of breath, severe fatigue, you should seek medical evaluation. Erectile changes can sometimes be an early cardiovascular warning sign. This video is about optimization, not ignoring serious symptoms. But in the absence of severe pathology, improving vascular inputs can produce meaningful change. The bigger perspective. After 60, blood flow becomes less forgiving of poor habits, but it is not fixed. Your vascular system is dynamic. The endothelium, the inner lining of your arteries, responds to what you feed it. Support nitric oxide, reduce oxidative stress, improve arterial flexibility, and the system often responds. Remember, erections are not just about testosterone, they are about blood delivery, and blood delivery depends on vessel health. Small arteries respond quickly, both to damage and to repair. That sensitivity works in your favor when you correct the inputs. Now I'd like to ask you something. Of the 4 foods we discussed, beets, pomegranate, olive oil, leafy greens, which one are you most likely to start incorporating this week? Let me know in the comments. And if this explanation helped you understand circulation after 60 at a deeper level, consider subscribing. On this channel, I focus on men's health after 60, with physiology-based explanations rather than quick fixes. Because understanding removes fear, and informed action creates results. Thank you for watching. I'll see you in the next video.